Hi, this is Dr. Jen Peña, and we're here to talk about all of the headlines in sexual and reproductive health that have been dominating the group chat. Welcome to Doom Scroll.
Dr. Jen Peña.
Hi, Zoe. How are
Hi.
you?
It's so good to chat with you. I just feel like every time I see something come up online, I'm like, I have no idea what this means, what's going on, and I need to talk to Jen. So, okay, let me get it right. The Biden Harris administration announces public private partnership to expand access to emergency contraceptive or to contraceptive care. It's not even just emergency contraceptive. And so I was like, first of all, what is that? Second of all, why is that?
Yeah, so it's super exciting because, this is really part of the administration's response to the Supreme Court decision that happened last year.
What does it mean to expand access to it?
Yeah, so great question. And there's actually tons of things that it asks for specifically in related to how that's going to happen. So one of the things, for example, is they want to improve contraception access to women in reproductive age who are covered by private insurance, for example. Okay. So I think Tessa and I spoke a little bit last time about the Affordable Care Act and how the Affordable Care Act essentially guarantees coverage for contraception in all 50 states. But one of the things, for example, with private insurers is that they're not obligated to cover all of the contraceptive methods that are approved by the FDA. They only have to cover one in each category. Isn't that interesting? So essentially, this order, for example, was trying to improve that and improve more access to one version of each form of contraception. Does that make sense? So that's one of the things that the order is calling for. The other thing is something like improving access to over the counter contraception, and that includes emergency contraception like Julie. So making sure that that is affordable and that it is available. So things like partnering with pharmacies so that we can make sure that these options are over the counter and available to people. And then some of the other things that this particular order is calling for is improving family planning services, because that's something that's, again, not necessarily readily available. So not just the contraception itself, but also planning on families and how you're going to, either conceive now or wait to conceive and all of the things that go into family planning. So those are just some of the examples.
Interesting, interesting. When I was reading this, I was sort of like, okay, well, who benefits from this the most? Who does this affect?
Essentially, they're trying to cover every woman of reproductive age pretty much, right? So this is a nationwide to everybody who meets criteria for being a candidate for any sort of contraception. It's not just talking about access, like having things available, but it's targeting insurance and what insurance is going to cover for folks to either significantly lower or simply just eliminate the cost of these contraceptives because it's preventive care. One of the things that, and I'm sorry if I'm jumping the gun here, but that I thought was really interesting is that it mentions a partnership with the private sector. And I don't know if you caught that, but it mentions this company called Upstream. And I'm only going to mention it because it goes to this point, which is even if we do all these things that the executive order says, sometimes, and I can say this as a provider, it's really about the provider's comfort in providing these services or even their knowledge. And also the knowledge of the staff to be able to do things like family planning. This company Upstream, the reason that the Biden Harris administration partner with them for this is because that's what they do. They actually partner with health centers, so hospitals, primary care, et cetera, and they do training for staff. So they do training, technical assistance for all of the staff, and they'll work with the physicians, with the NPs, midwives, et cetera, just to be able to ensure that everybody in these health sectors are comfortable and trained to do women's and reproductive health.
What is the timeline on something like this? This I think partnership with Upstream. What is the timeline on this actually coming to fruition?
That's a good question. I would like to say that in politics, I don't know what the answer ever is. The good thing is because it's an executive order, essentially goes into action right away.
I love this. Thank you so much.
Thank you, Zoe.
Always, always helping. Always a pleasure.
I try.
Talk to you soon.
Bye. See you soon.